Okay, it's been 6 weeks. Yeah, today is 6 weeks since my gender confirming surgery, and since my last surgery update video, and seen the doctor. Well, how I mentioned he cleared me for self-stimulation. Well, because what he's been wanting me to do is massage down there to help the nerves and everything, because the nerves are still healing, to let my body know it's okay to be touched and help desensitize the nerves. But some research I was doing correlated to part of the reason why I was having the issue with one of the nerves. It's just pretty much from what I've researched. When you have surgery, what can happen is like the sheathing around the nerve can be damaged, and when you stretch, like overstretch in any direction, or it becomes too compressed in that area, it can cause stinging. And going by what was going on with me, that correlated to the research I was doing. So I've just been trying to just relax more, not move around as much, to let that nerve heal, and it has gotten better. And using the neosporin, either neosporin or bacitracin, 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 which one's a brand name, one's the actual medicine, which neosporin basically has that in it. So how I mentioned, you wanted me to be using that where I've been having the issue with the pus. Since I've been using that, everything's healing a little bit quicker, and I'm not having that pus anymore. The last time I did have pus, I was pretty much trying to get it drained out to help the body so it heals the rest of the stitches, that because he cut the stitches, but there's still some that was stuck under there. So when I was squishing it out, the stitches came out in those two spots. So that's pretty much part of why it's healing a little bit quicker, not having those stitches in there. And using neosporin on it has been helping it to heal. I haven't had pus in about 3 days or so, so that's good. And let's see here, the way everything's healing, the swelling has gone down. I still have that asymmetry. That's, well, at this point, it's not gonna go away. It's just the way my body decided to heal itself. So I'm pretty much, if I want to have that asymmetry fixed, at my appointment, there'll be a 6-month appointment with the surgeon. Yeah, the one who did the surgery. That's when I would be able to have a revision, because you have to wait 6 months depending on what's being done and who you're seeing. But for the revision, I have to wait 6 months for everything to heal. so I can pretty much have that fixed. So just have to see how I feel by then, because the way I'm feeling now, I don't want to have that touched surgically. I just really don't want to have it messed with right now, because how rough I was having it here and there with the nerves and that stinging. Let's see what else has been happening. Well, with the self-stimulation and the massaging, because of how my body's healing quite quickly, and like how some people have to wait a little bit longer and some people don't. I'm one of the lucky ones that don't have to wait. I can actually explore down there, which I've been doing. I've been, I can't say a whole lot, but here and there, I've been actually exploring my body down there. Just getting used to it. Like everything, also with everything I've learned before surgery, like sexual wise, like sex wise, sexual, on the female side of things, I've actually took that into account of everything I've learned and applied that to my body down there, how it is now. And I've had everything good experience so far. Like with the self-stimulation, with the labias, the clitoral hood, and the clitoris, and the vaginal canal and everything. It's so far, it's fully functional at this point, and haven't been having issues with anything becoming not functional. But yeah, it's really more functional than I would, that I hoped it would be. It's like more so. I've noticed the labia majora, even though the feeling is there, I can't say a whole lot of like feeling and sensation. It's like before surgery, it just feels the same. And the labia minora is more sensitive than the labia majora. And the clitoral hood feels the same as before surgery. And the clitoris is more sensitive than before. Because before surgery, compared to now, it's more sensitive than what it was before. I know part of it is because it's still healing. The other part is hormones and how the surgery was done. It's more than I would have ever hoped it. It's more. And I'm really happy about that, because that really helps with my dysphoria. Because like sex-wise, like actual, the act of sex, or like sexual stimulation by myself or with someone, now compared to before, it helps with my gender dysphoria and anxiety. Like the anxieties and everything I had from before compared to now, it actually now it helps with that. And one thing I've been noticing, because I have a high sex drive and I still do to this day, even if the hormone difference after surgery, being 6 weeks out, I still have a high sex drive that has not gone away. And spontaneous orgasms, it increased. I know it was increasing until yesterday when decided it was the right time. Just me and my girlfriend, my partner, we decided it was the right time to explore myself down there and relieve it, because I noticed before surgery, when I feel my sex drive, how I have a high sex drive and feel everything down there, like an orgasm gonna happen, and I don't do anything about it. And what happens is it triggers spontaneous orgasms, which to a point can be really overwhelming, exhausting, and not pleasurable at all. But decided to explore sexually, and it was the first time I had someone, it was the third time having someone finger down there vaginally. The first 2 times were doctors to check everything. No, it was persons. Maybe that third third time that wasn't myself. Yeah. So it's like sexually, how it sings like the third, fourth, before different. 2 times that wasn't me, was the doctor. Then yesterday's time was my girlfriend. I can say that I'm not ashamed to hide it or anything, because this is my experience and what it's like from my experience. Well, I can say when I stimulated myself vaginally, fingering that first time, when I started, the way it feels, the best way I can describe is how I mentioned before, the texture is like the inside of your cheek, but the actual sexual stimulation for myself, it wasn't as strong using my own fingers, because I haven't been comfortable with tri-toy yet vaginally. So I just been exploring, even with the massage, to help prevent scar tissue. It wasn't as strong, but yesterday when we were exploring everything, when she did it, it was a lot stronger feeling. It was more pleasurable, and it was enough to trigger 8 orgasms. And all I can say is the 8th orgasm was one of the strongest I've ever had. I can say it was, the reason why I can say it was the best I've ever had is because I had more of like a physical and emotional attachment connection with it, with my girlfriend. So that made it the best I've ever had, I can say. And just that release. It's like when I climaxed and that release, I pretty much cried a little bit, and just tears of happiness, and that relieved all of the spontaneous orgasms I was having. It relieved all of that. Because going by in the past compared to now, my body's still functioning in those same kind of ways. Like in the past when I relieved it, it helped prevent more spontaneous orgasms happening. And compared to now, the same thing. But it's more pleasurable and it feels good, and I have a stronger mind-body connection with it, which helps. It's helped with my gender dysphoria, and it's helping just overall, and it feels normal, it feels right, and it just, there's nothing that can really compare to that strong connection. It was just, because I was thinking before surgery, how it's like if it feels like this before surgery, like G-spot stimulation and whatnot, how it would be after, which I haven't really gotten explored 100% G-spot stimulation long enough, but just having that vaginal stimulation, being fingered, it was, I can say, the best I've ever had. And how it feels now, it's compared to before, it's a lot better now. So, would I ever do it again? Yes. Tons of times. Because one of my thoughts before surgery was, once I have the surgery and I'm able to, I'm going to look at it enough so it's like I've had it my whole life, and I'm going to explore down there enough so it's like I've been doing it since a teenager and all that. That's what my thoughts were, and I still feel that way. I'm just waiting for more of it to heal so I can do more kinds of exploring. And yeah, but there's that one thing that's kind of, since everything's healed enough, all the feeling and everything's come back down there, and everything's starting to come back to normal, because I still identify as a lesbian with a fluid sexuality, and Um, that means for me, a lesbian with a fluid sexuality means I like women in general. Doesn't matter if they're cisgender or trans. Like a cisgender woman or a trans woman. Women are women and we are too, in a sense, and I like women in general. And the fluid sexuality, because that's my sexual orientation, but sexuality and sexual orientation can be two separate things, even though your sexuality is, like your sexual orientation is one way, your sexuality can change over time. The way my fluid sexuality is right now, it's still on the female side. That has not changed since the summer of last year. And since surgery, it's been how it fluidly changes how I want that intimacy. It's like sometimes I just want toys, sometimes I want the real thing, sometimes I just want to cuddle and just be there with the person. Which obviously would be my girlfriend at this point, because I'm not going to with anyone else. And lately it's just been strongly, even though I don't like male structured genitalia, my body's just, the fluid sexuality's just been craving it, the real thing. And it's hard to deal with when I don't like it that way. I don't like well-structured genitalia, but my body's craving the real thing. Like, I want to know what it feels like that way. I don't want to have a man's. What comes to mind would be like a female who was born with it, or a trans woman, which the only one that I would be my girlfriend's, only if she was comfortable, because she's still pre-op, but other than that, the topic of discussion was the best way, because like in a relationship, even before surgery and after, is having that good communication with how everything's feeling when you're having all these things come up after surgery. It's good to talk about things. So best thing we've come up with, which she's mentioned, would be toys like a strap-on, or the infamous clone wheelie kit you can get. Because I know she wouldn't be comfortable with using hers that way, and I wouldn't want to force her to, because how I was thinking before surgery, I may have mentioned in another video, only if she's comfortable with that, using it, I'd be okay with it, only if she's comfortable that way. But because she's not, I'm okay with that, and there's other ways that can work for me and her together. So that's something that's come up since surgery, how I'm feeling, especially how everything is like almost healed enough to actually use a toy and whatnot. So yeah. So other than that, one thing I wanted to mention was my dilation schedule, because how each place does it differently. Some places do 4 times a day for dilation, and some places like 4 to 5 times a day, and some do like 2 times a day. My dilation schedule, how I have to do it is in the morning when I dilate, I have to use, currently right now, this is what I have to use in the morning. Basically, stick it on the dilator and use that. Like lube up the dilator with it and use it. Then hold it in there for 30 minutes. Then you flush out. Well, she was wanting me to, like one of the doctors, the one that works with the dilation part of the surgery, aftercare, she was wanting me to use this in the morning, leave it in, but flush off the skin, and my second dilation at night, pretty much before I go to bed, I use this is what I use. Yeah, this is the one I use. That one you leave in, you don't flush that one out, and you dilate for 30 minutes. This one is more like a gel, and this one's more like liquid. Like the best way I can describe this one is the Neosporin that has the pain relief. The kind I mentioned. It's kind of like that texture. And yeah. And the dilators I use, if you have the set of 6 dilators, I highly recommend getting the set of 4 dilators. This is the brand, and it comes in like a pouch like this, which you have the small, the purple one. This is the small dilator, the smallest. This is the medium one, the blue, the second biggest. This is the large. This one's the large. Next size up. And this one's the extra large. This is the biggest one. And when I'm dilating, I've actually made it to this one within, it was about a month, pretty much. And with my depth, because these are the dots you dilate to, but because of my depth, I'm right here, and that's 4 inches. So this is the small, and this is the extra large, so you can see the difference. Yeah. And I'm not able to go any bigger than that because my pelvis, I have a narrow pelvis, so the orange dilator is the biggest I can do, which it's an 1.5 inches. Yeah, from the distance here to here is 1.5 inches, and I'm not able to go more than that because having that narrow pelvis from side to side, like if going like this way, laying down from this side to this side, it pretty much hits each side. So how I mentioned with my fingers, I can barely get that much in. So if I was to compare on it from here to here, these 3 fingers from side to side, it's, yeah, pretty much my maximum I can actually get in there. So yeah, and dilating is getting easier and easier each time. And the biggest suggestion or tip I can give when dilating from my experience, I can't say on anyone else's experience, but for like the first month, you're not supposed to use the dilator, like go in and out, like masturbating wise or anything like that. You're not supposed to move it in and out. But once you get healed enough, the best thing I can suggest to get it in easier is kind of like coax it in when you're healed enough. It's like when you kind of stick it in, then you pull it out a little bit, then you put it back in a little bit to get the body to relax and open, to give like the signals and everything that it's like time to open, to let it in. Because when you do that, it like opens it up a little bit, and you coax it out, and you slowly move it back in, then it opens, then it helps the vaginal canal and the opening to actually help it to open and spread a little bit more, so it's not staying tight. And that's something I've been doing the last few days or so, and it's been helping to get it in easier. But before, when I was still using the green dilator, I wasn't able to do it that way because it wasn't healed enough. But because it's healed enough now and able to do that, it's actually a lot easier to dilate. So that's my biggest tip. And one thing I've been noticing, what the doctor said when he checked everything inside my vaginal canal, he was saying that there are sores in there. They're still open, like sores. And that's where some of the drainage is coming from. But since my appointment last week and now, I have a lot less drainage, and the sores are actually healing. And the one I can actually see is healing very well. And it was weird because with all the spontaneous orgasms and everything and whatnot, I haven't been really feeling those sores. I haven't even felt one of those sores at all. They haven't been painful or discomfort or anything. But I noticed with drainage and all that, there's a couple of times I couldn't tell if it was the medicine or if it was actually my body's producing vaginal fluids, like sexually, with having those spontaneous orgasms. But yesterday, with exploring everything, my girlfriend was saying, because when you're doing penetration, it's highly recommended to use a lubricant, water-based. And my experience, water-based I'd say just trust me on that. Water-based would be the best, because with water-based lubricants, you can actually leave it in, not have issues. And if you get the right kinds, it can actually, your body can absorb it naturally, and it doesn't harm it, anything. So she was saying that not everything was a lubricant. Like pretty much my body's producing some. So yeah. And with more exploring and everything, can figure out more if and how much my body is actually producing, because I was told that the vaginal canal, the way the surgery is done, it won't be like it's creating its own fluids, being more like moistened skin. But from my experience, it seems like my body's actually producing fluid only when sexually stimulated, I can say. Either spontaneous orgasms or like penetration, I can say, when my girlfriend did it. So I have to see if my body's actually producing its own fluids. So I have to have more healing and do more exploring and see. Then I could do an update when I find out more on that part, because depending on how the surgery is done, you can actually produce fluids and get wet and everything. And from my experience, a few times, it was from the spontaneous orgasms. I was really wet a few times, and yesterday my girlfriend was saying not all of it was lubricant, like the water-based lubricant. So have to see. So other than that, that's what's been really going on with the healing. And the two things that came to mind, how I mentioned I have 2 lumps. One is off to the side on the clitoral hood. The one's like in the middle on the top part of the hood, right above the clitoris. Those lumps have actually gone down in size. The one that's on the left side has gone down in size and is more flat. It's and reduced, because it felt like it was spreading, but how much it was spread, it has reduced in size. And the one that's right above the clitoris, that's inside the hood, seems like it's smaller. So you just have to wait and see how it heals. And I've been noticing that as it's healing, there's more of a distinction between the clitoral hood and the labia minora. More so on the right side, because the right side's healing much quicker than the left side in terms of the swelling. So, yeah. But other than that, I've just been very happy with it. Feels 100% normal, like it's always been there. And the more the swelling goes down, the more normal it looks to my body size. And yeah, so other than that, I'm extremely happy, and I don't regret one bit of anything in my transition from the first pill I took to surgery and where I'm at now. And everything, how I'm feeling, is happiness. And everything that's happened wouldn't have happened if I wasn't trans. The way it's happened, and the way everything's happened to this point, I'm really happy that it's happened, and that everything's played out the way it has so far, especially the surgery and all the struggles regarding the surgery, and because of it, getting a girlfriend out of it. It's been, all I can say, it's been a blessing in disguise. That's happened because of me being born trans, a trans woman, and a lesbian with a fluid sexuality. So, all in all, to me, and with my experience with it all, 100% of it was worth it. It was worth it. So, until my next video, please, if I haven't mentioned anything you want to know, please comment, ask questions. That's how you learn. It's how we learn, is by answering questions. Because the only stupid question is the one not asked. So if it's on your mind and you're watching this video or any of my previous videos in my surgery video series, post-op series, please ask. That way you can learn too, and others can learn from it. And I will answer the best I can from my experience. So please comment. So until my next update, please comment, rate, and subscribe. Until my next video.